Hello, I am here again, Dr. Sheila Craig Whiteman, the pelvic coach, and today we're going to talk about menopause and the relationship between menopause and bladder leaks, because actually there is one. It's actually twofold though, because menopause, of course, is that transition from women from having their period to not having their period and fertility, and the hormones starting to diminish and decline. They don't go away they're not gone all the way, but they do decline significantly. And one of the hormones that declines significantly that has a really big role in what goes on with your pelvic floor and your bladder is estrogen. Estrogen has a lot of really beneficial effects. It might help to protect your bones. It might help to protect your heart. One thing it does do is it really helps to keep your muscles really act with a little bit of vigor and stronger. And when you couple the fact that you naturally have decreased muscle strength with age, because well, you do. So you're with aging, the muscles naturally decrease in strength. And then we're going to top that off with a little bit of loss of estrogen. And adding in that loss of estrogen exacerbates your muscle loss and your muscle integrity. One of the main reasons women have urinary incontinence or bladder leaks during the menopausal years is because of muscle weakness, that pelvic floor muscle weakness. And I think what one of the talks I think I'm going to do is what is the pelvic floor? Because I know I'm always talking about the pelvic floor. Let's, the muscles of the pelvic floor. Well, Sheila, what are you talking about, and where are they? Which is, something I used to always get when I was in the clinic and talking to my patients, or even doing coaching and talking to my clients. I would be talking about the pelvic floor. Everybody knew what this pelvic floor was and what it was doing, and it was blank stares. Like, I don't know what you're talking about. So we're going to talk about that maybe with a visual next time, because I think a visual would be great and appropriate for helping everyone to understand where this is and what's going on with it. So we're going to do that. But I'm going to get back to task, because I'm going to stay on topic. And my topic is menopause and bladder leaks and the reason why this happens. So let's really delve into this. So we talked about the weakness. And that is one of the primary reasons is weakness of your pelvic floor. But also with menopause, now you have weakness of your pelvic floor. Your pelvic floor muscles, what do? They help with continence, okay? So they close that sphincter so that urine can't come out. They help to control how that works. But it also holds your organs, your pelvic organs, uterus, bladder, etc., up into your abdomen, where they should be, like right up above your pelvis instead of dropping down. Now, what happens as your muscles age and get weaker is that these organs can start to drop. Many people, women particularly, have heard about pelvic organ prolapse. You hear about it more if it affects you. A lot of women have it, but if you're asymptomatic, you're not going to seek help and look for something that is not bothering you. But the prolapse, muscle weakness, increasing muscle weakness, age, all of these things really relate with increasing bladder leaks during the menopausal time. Another problem that some women have during this time is an increase in urinary tract infections too. So if you're noticing that you're having more UTIs, or just even starting to have UTIs, UTIs, and having some increase in the bladder leakage that you have. So more leakage when you're coughing, sneezing, more having to run to the bathroom even, more frequently. That is a time that you want to really get in and get some help or get some information. I have my 2 books back here behind me. You can even just you read the books and get a little bit more information on what you can do and kind of nip this in the bud before it gets to be a problem. Also, I'm going to say this quickly because my time is up. I try to keep these very short. But we also gained some weight, during the menopausal years. And weight gain has also been associated with increased bladder leaks. So if any of this resonates with you, of course, make a comment, share. I would love for you to share, and also to like my channel. Just a reminder, if you need help, you can always contact me. You can go to my website, thepelviccoach.com. And I'll see you again next time. Thank you so much for listening. Bye-bye.